as Albino Trust of Zimbabwe, today we've joined the government of Zimbabwe and the rest of the world in commemorating the World Sight Day at Sekuru Kaguri Eye Unit today, where we are just giving free services to the members of the public. This is going to go a long way in ensuring that even those who cannot afford, they get the chance to actually get these services for free. Remember, it's not all about money, but it's all about us being humans. So sometimes, even if we know that spectacles are hard to come by, they are expensive, but in days like these ones, that's when we talk about universal health coverage. So even those without money, we'll be telling them to come and buy without money, because what is important on occasions like these ones is that people get their sight, and we bridge the gap in terms of access as well as visual acuity.
Okay. So how many are you targeting today?
Yeah, today we have nearly 800 glasses in place. We don't know how many patients will turn up, but this is what we have in stock for the patients so that they can also benefit. And this is our prayer that the members of the public will come and get these services. If you have seen, a lot of people have come, but we are still looking forward for more people to come. Because a lot of people even doubting whether that is possible because of the monies that are being charged out there, especially when it comes to access to eye health. But we look forward for these people to come in their numbers. And I'm sure we don't need to just have this done in Harare only, but we also need to decentralize this thing to be done in also other places and other provinces so that a lot of people can benefit. And once this is done, we look forward to complement the government's effort, especially when it comes to national health strategy. So once that is done, we are very sure that will go a long way in preventing avoidable blindness, especially through eye health. Remember, it is the day that we have promised also to partner with the Sekuru Kaguri Eye Unit to actually be doing cataract surgeries so that we can reduce the backlog, the current backlog when it comes to eye health, especially cataracts that is existing within the country. Said and done. We look forward to ensure that the government of Zimbabwe will benefit, as we have the MOU with the government. We have got an MOU with the Ministry of Health and Child Care to actually offer comprehensive eye health. So once this is done, we ensure we are looking forward to see it happening and ensure that we live to our expectation as well as our promise that we had with the government of Zimbabwe. I think what we've done today is one of those steps that we are working towards what we agreed with the government of Zimbabwe, and we look forward for a cordial relation with the government of Zimbabwe, like what you see, everything is happening well. We have support left, right, and center from the local government to the national government. So all these things are things that we are anticipating that they would continue in this direction. And once this continue in this direction, we are so happy that, and we are hoping that we are going to save 23,000 people with spectacles before the end of the year.
We are going to use them for all those people who are usually over the age of 40. What we call presbyopia. Right? Presbyopia, it comes when you hit the age of 40 years. You start having difficulties with reading small print. So to save you from difficult challenges, so that to make you able to continue to read and write, then we give you what we call presbyopic glasses. And this was the range. Those who have just reached the age of 40, usually they got less power. But they range from +3, +1 to +3.5. These are the reading glasses. And we give them, usually we can almost give according to age, but we normally test them so that we give them the correct reading glasses. They are for reading. But once in a while we get people who, if they put on reading glasses, they'll be able to see for distance. These ones are people who have got what we call long sight or hypermetropy.
So what is the current situation with people with eye challenges in Zimbabwe?
In our country, we have got the majority of people fall into the common diseases that we prioritized and identified as a country. We prioritize childhood, eye diseases and cancers. We prioritized adults, cataracts, because they're, and then we prioritize things like refractive errors, glaucoma, complications of diabetes mellitus, because these conditions, if they are identified, like I said in my earlier speech, 80% of avoidable blindness is reversible and preventable. Those causes where you cannot do anything, whether you go to America, those are the ones that account for the 15 to 20% of what is not reversible. Right? Like people born with abnormal eyes and stuff like that. It's very little you can do about that. Right?
So any
One, they must be identified and they must avail themselves for screening and treatment. Some of them will be surprised, or they will be surprised to find that there are conditions that can be reversed, and then they can see again. So that's what we want.
Ifashwa ndabatsirwa problem ndemaziso ari kuvava ndisingaoni kana kuverenga ndichakwanisa kunyatsoverenga ndichakwanisa kuona kuverenga saka ndabatsirwa ndanzi nditenge ndipuwe mishonga nekutenga magirazi nekupiwa magirazi sorry.
saka chirongwa ichi machitambira sei chekupiwa magirazi
ndachitambira zvakanaka chaizvo kutenda zvakanyanya kubatsirikawo kuona ikoko nekuverenga kutenda zvakanyanya nevakaronga nevarongi vechiroga kutibatsira kupiwa magirazi zvichidhura asi isi tichimbopiwa pachena.
Muna makore mangani?